Does the military provide veterinary care for its people and dependents?
To a limited degree, but since there were no other veterinarians in Puerto Rico, they made the exception and allowed us to do as much as we could to help the dependents, the servicemen and their dependents.
Would that be the same here at Beale? Is there someone?
I think they're very limited at Beale on what they can do.
Well, there are very many veterinarians in this area. You said earlier there were more than 10.
Mm-hmm, right. At Beale, I think the veterinarians are restricted again to public health matters, maybe vaccinations.
What does the state of California require before someone can call themselves a veterinarian and open up an office?
You have to be licensed by the state of California. You have to be a graduate of an approved veterinary school. So usually after 8 years of training, you receive a doctorate degree, then you pass your national exams and your state exams. And once you've done this, you can apply to that state, and they will grant you a license.
Very similar to regular medical care for human beings.
The same thing.
Well,
the same thing.
Are there specialists in veterinary medicine like we have dermatologists in regular medicine? Are there specialists like that?
There sure are. They can. Many veterinarians stay on for an additional 3 or 4 years of specialized training in skin diseases, like yourself, a dermatology, radiologists. Acupuncture is a big thing now in veterinary medicine.
Amazing.
So almost anything you find in the field of human medicine, you now find veterinarians that will specialize in those areas.
Many of our viewers are considering plans for their future careers. We just had high school graduation, people looking on going to college. Are there opportunities for careers in veterinary medicine now?
A recent study conducted by the AVMA states that there will be an overabundance of veterinarians here in the next few years, believe it or not.
Competition's really
competition is keen. I would like to mention, though, that at Davis last year, 60-some% of the new students were females, and women always felt that, well, they didn't have a chance to get into veterinary school. Today, it's the other way. There are more women veterinarians being graduated, or will be in 4 years, than men, which is fine.
Huh. Are there any ancillary fields where people can work with veterinarians without actually going through that rigorous veterinary school program?
Yes, there is a program in California, well, all over the country, really, but in California there are 10 schools that will train people to be animal health technologists or technicians. And it's a 2-year program. Yuba College has an excellent program. The graduates, again, have to pass tests and be licensed by the state.
So there may be a few more opportunities for these people than veterinarians, I would think.
And they do not have to go through the 8 years of training.
It's 2 years,
2 years.
Right. Yes. So they could work in, as an example, they could work in your office if you needed someone to assist you in that area.
We have animal health technologists that work in our office, and we also have volunteers from the college on a regular basis.
Good. I understand that some veterinarians specialize in large animals rather than small animals, as we saw in the film today. Did you ever consider working with farm animals instead of the domestic animals?
I did, Bob. I worked with cattle and horses for 6 months on a practice where I was by myself and in the service. I enjoyed it. I enjoyed being out in the country and being with the ranchers, getting that fresh air that I don't receive in a building in a clinic.
Right. Was it a difficult decision, though, to specialize in small animals, domestic type, that you're doing now?
It was difficult to give up that freedom of being able to move around and travel around the countryside, but it's difficult to keep up with all the current literature in all aspects of veterinary medicine.
But your training covers all areas of animal care, not just the small animals, which most people see their veterinarian working on.
Yes, in fact, the students today also are trained with in reptile medicine and fish and the exotic animals. When I went through, we studied 7 different species of animals. Now, of course, they're introduced to a lot more.
I bet. Plus numerous diseases, numerous new treatments, medications. Well, we'll all remember that. Can a veterinarian write prescriptions that can be purchased at a regular pharmacy?
Yes, many of us do. We normally keep things available just for the ease of the clients can pick it up before they leave the office, but on some specialized drugs we can write a prescription.
Great.
And
so
we do.
Patients can go to, I don't know if I should mention, well, I'll mention Long's or Rayleigh's or any place they can go and they can get drugs there. That's great. Great. Can you write them for people, though?
Not at all. Okay. We do not do it. Anything with human medicine.
Okay, just wondering.
The state frowns on that.
Okay. In my practice, I'm continually faced with patients who've had bad reactions to flea bites. And I know fleas are a big problem for your patients as well. What do you recommend for families that are having difficulty with fleas?
Fleas can be a problem not only on the pets, but in the house. The pets can bring the fleas into the house, in the yards, under the house if the dog is allowed to crawl around the foundation. It's a good hiding place for fleas. You have to be aggressive because fleas are hard to control, and we recommend various shampoos with flea killers in them, powders, sprays, you name it. They have all kinds of things to help control the fleas, not only on the animal, but in their environment.
It certainly is a big problem in this area. Besides regular fleas, you have the sand fleas and all kinds of things going on.
It's such a mild climate. They just survive the winters here beautifully.
I love it.
When the weather warms up, they're ready to go.
I understand that proper nutrition is extremely important for animals, just as it is for human beings. Is obesity or being overweight a big problem in dogs and cats?
There is a small percentage of the animals that come in that are obese, and it's normally, could be a disease process such as hypothyroidism that causes this, but usually it's a case where the owners just are overzealous in feeding these animals. They feel they need 3 large meals a day instead of 1 normal meal.
Is that what a dog needs, 1 meal a day?
They do very well on 1 meal a day, and many dogs are fed twice a day, but you should make one of the meals a little light.
Now, this time of year, with the heat starting to catch up with us, do you have to give dogs more water? Is that a very important thing?
Definitely. Also, most animals reduce their feed intake by about 20% because of the hot outside temperatures. So you should cut back on the amount that you give them during the warmer time of the year.
But have a lot of water available.
Plenty of water, for sure.
Okay. You mentioned that thyroid can cause being overweight in animals. What are some other ways that thyroid diseases would show up in animals?
Chronic skin disease in animals often have hypothyroidism as a basis for their sensitivity to things. Chronic ear problems, even chronic persistent lamenesses sometimes are due to hypothyroidism, low thyroid hormone levels.
How can you prove someone has low thyroid? Dog, what would you do?
We do thyroid function tests, they call it. Blood tests. We take blood samples and send them to a veterinary lab in Sacramento, and they can test for the level of thyroid hormones.
Then would you actually give these animals thyroid if they needed it?
Yes, we have many animals on thyroid medication. It's incredible how many dogs and cats are affected by hypothyroidism.
Would their activity change too? Would they act sort of run down and...
Classically, they're a little listless, they're a little overweight. They just do not have the extra energy and oomph. Sometimes those are the triggering symptoms to make you suspect hypothyroidism.
What type of vaccination should all dogs and cats have?
Of course, rabies is one of great concern in this area because of the rabies scare we had 3-4 years ago, and the increase in rabies in dogs and cats all over the United States in the last few years has made it mandatory that you vaccinate your animals for rabies. Parvo in dogs is a new disease just on the scene the last 4 years, just evolved.
Is that a viral disease or something?
It's a viral disease that evolved probably from the cat distemper virus, and now it affects just dogs, and it has been a large killer of dogs in this area in the last few years.
How would a dog show this disease? What would
usually vomiting, diarrhea, bloody diarrhea. And then, of course, you have distemper in dogs, which is always a problem, has been for years. Leptospirosis, hepatitis.
Are there vaccinations for all these things? Even hepatitis?
Yes. There's a canine hepatitis.
Should every dog have this vaccine?
For sure. They should have their shots when they're young and then their annual boosters.
Can dogs and cats catch colds like people catch colds from viruses?
We feel that they do share some of our viruses now. We used to say, no way, don't worry about it, but now the pneumonitis virus in cats will affect man, and we're not so certain now that we're not sharing these things.
Do you think that people can catch colds from animals?
Again, I would have to refer you to a virologist on that or an epidemiologist, but I think that is going on.
Possibly going on.
Sure.
That's interesting.
Excuse me, I sure hear from a lot of clients who say that their cat is sick and they've been sick with a virus for 3-4 days and now their cat is sick. So that makes me suspect that maybe there is an exchange of viruses.
Are there dentists that take care of dogs and cats, or is that your role as a
There
veterinarian?
are veterinarians that specialize in strictly dental practice, not locally, but we all are dentists because dogs and cats do tend to build up a lot of dental problems. They do not brush their teeth twice a day, and people don't always look at their dog's teeth. You'd be surprised that...
Do you recommend having the dog's teeth cleaned, like we go to a dental hygienist to have our teeth cleaned?
Sure. On our annual exams for vaccinations, we always check the teeth, and if there are diseased teeth or buildup of plaque, then we recommend that they be cleaned.
How dangerous is a bite from an animal, assuming the dog is healthy?
I think with the shape of most of the dog's teeth and cats, the amount of debris and bacteria in their mouth, I would have to assume that a dog bite or a cat bite has to be a very serious problem.
So it really should get some medical attention.
Sure, and that's why those teeth also ought to be taken care of on these animals.
Very good point.
You know, especially if the dogs are snippy.
Unfortunately, our time is running out. I'd like to thank Dr. Ringen for taking time out of his busy schedule tonight so that he could join us on the Medical Explorer. Thank you very much.
Well, thank you for the opportunity.
You're welcome. I'd like to invite you to write to me at the Marysville Medical Clinic with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 800 3rd Street, Marysville 95901. In my next program, the Medical Explorer will examine speech pathology. We will observe the health professional who teaches patients to speak after the speech portion of their brains are damaged from severe strokes or head injuries such as gunshot wounds. It's a fascinating subject, and I hope that you will join us. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.